All right, guys, I appreciate you jumping on here for this. This will be the first of probably 3 or 4 webinars that I'll be putting together over the next few weeks here. And with this first one, I wanted to discuss offset training, which is something I get a lot of questions about and something that really isn't widely practiced or commonly known, but something that personally I've had quite a bit of success with my athletes. Really, just in general, it's a fascinating topic and I think a really unique training modality that is really uncharted territory, and there's a lot of unknown to it. So with that being said, I want to be very clear with this one. Everything that I'll be discussing in this is purely theoretical and anecdotal. There is absolutely no or very little formal research that has been done on this topic. So if you're somebody who kind of lives and dies by the scholarly research, this one may not be for you. With that, I do think that this is something that has started to grow a little bit and become more pervasive, and I think within the next couple of years, we'll have some more formal understanding of this. But for all intents and purposes today, this is just kind of my understanding and my takeaways with offset training, and I think that this is something that for most people can be used in some capacity, and for certain populations can be used quite extensively for success. So really quick background. The first time that I ever experimented or sampled offset training was actually back in college. So we're talking about like the 2010, 2011 timeframe. And I was training with some bodybuilders at the time, and one of the core movements that they would do quite often is just a simple offset standing hold where the barbell's just racked like a back squat. You just have, a 25 or a 45 on one side and nothing on the other side of the barbell. And the reason that they were using it was for, oblique strength. And at the time I was like, oh yeah, this is cool, nothing crazy, but, you could definitely feel that there was something different about it. A couple years after that, never thought about it again. Didn't really do anything else with it until I had an athlete back in 2017 who was just recently coming off of a really nasty bout of cancer, and it was in his thorax and kind of his upper abdomen. And so they effectively had to go in and break his sternum, several ribs, cut through the pec minor, the lat, and it was a really nasty ordeal. But the takeaway was that he had extreme asymmetrical imbalance left to right in his upper body. And so just kind of on a flyer, it occurred to me to maybe try the offset application and see what we could get done with it. Well, after about 6 weeks of working with him, the offset loading had been tremendously effective, and we were able to clean up quite a bit of his unilateral dominance and really kind of get him back to being centered and help with some structural deviations in the upper torso. So once that point came to pass, that's when I started to dig a little bit deeper on the offset stuff and really just kind of started using it as an application intermittently with different people, different individuals for different reasons. And, I've gotten into some cool stuff with it. So as I mentioned, this is, again, really entirely anecdotal and my takeaways from this, but I have used this in a variety of ways, and obviously we'll be going through some of those, but for all intents and purposes, this is a reasonably advanced application, and this is something that I would not recommend anybody doing if you haven't already developed a robust foundational strength. But what we're doing here is we are looking to try to emphasize the core and the trunk with conventional compound movements. And so by deliberately unbalancing the barbell, what we're doing is we are forcing different muscle groups or different vectors, lines of force to activate. And obviously, I think there's also a lot of fascial implications here. But really what this does is it just makes the movements much more trunk-centric or core-centric. It's very good for cleaning up, like I said, non-functional asymmetries. And I would also argue that this is just a really engaging and kind of mentally stimulating training application. And for most of my athletes, they just really enjoy, kind of the cognitive demand of it. On a little bit of a more technical side, the premise here really is kind of boils down to three things, and those 3 points are neurological demand, the demand on trunk stability, and an increased work capacity. So with the neurological demand, what we are looking at here is basically emphasizing or kind of straining the joint receptors in a little bit of a different way. Because the external load isn't evenly balanced, it's going to force a different sensation from the joint capsule or the joint receptors. In addition to that, I also think that this is kind of an inherently anti-rotational or anti-bending, even like a little bit of kind of torque resistance, irrespective of what the movement is. So for that purpose and that purpose alone, we're going to get a little bit more out of, or need a little bit more out of the ligamentous structures and the connective tissues to help keep our joints centered in order to complete or achieve the movement. Some of that kind of bleeds over into the demand on trunk stability because of the constant contralateral or the reciprocation that's demanded from left to right with offset loading. It just really takes the demand on the trunk up through the roof. And I think also too, again, going back to the vectors of the lines of pull, because this is an unbalanced load, it almost emphasizes muscles that sit at kind of unique pennation angles. And, again, that's another one that for that reason alone, that can be highly beneficial for people when you see athletes who have overly dominant prime mover muscles. A lot of the time, some of the synergists and some of the more supporting casts get overlooked, and then that can create a greater imbalance or margin of difference between strong and weak sides. And then lastly here, we're looking at increased work capacity, and I think in part that's due to the exhaustion from neural demand and honestly just the cognitive demand, really kind of driving people's fatigue. And then, we also have the factor of just empirical volume, where if we have to do something on the right and the left side to complete the set, we're just going to get more repetition out of it. So some of the basic applications here, starting over here on the left, we have just a very simple novel band offset. And this is something that I'll use for push-ups, for planks. We'll use this for split squats, step-ups, really a host of different movements. But all this is really doing is adding a frontal plane vector to a sagittal-based movement. So in theory here, we're getting another set or group of muscles activated or engaged in the movement that is creating a greater global demand, and that demand is again going to be centric to the trunk. So when you're doing something like a push-up with a band offset, now you're not only fighting against gravity in the push-up action, but also maintaining a neutral torso and a neutral pelvis with a frontal plane pull. All right, so we're going to take a look now at a couple of band offset variations here. So this first one is a push-up. This is definitely one of the more common ones that I use. It's probably the most simplistic or intuitive to add into the mix here. So like I mentioned, we're just adding a frontal plane vector to a sagittal-based movement. So with this, we're working against gravity as we normally would in a push-up, but we're also now resisting our trunk or core being pulled out of position here. So this is one where I would say athletes who have poor serratus development, poor scapular control, and athletes who you see have kind of that hip shift position in their push-up pattern, this is a good variation that you can add in as like an intraset pairing with a bench press or a push press, something along those lines, or just a general accessory movement. Second band offset variation here is our overhead march. So here with this one, you can see I'm using a kettlebell load as well, so getting some combo dynamic and static resistance. This is a fun one. This is one that I'll use for athletes who have poor lat extensibility, as I clearly do here as well, but athletes who have difficulty getting into full overhead flexion. Obviously, athletes with poor lateral bending or oblique stiffness. And then also I'll use this for athletes who have weak or dysfunctional QL, because again, we're trying to work in a vertical fashion here on our marching pattern, but now we have the added challenge of maintaining the band position overhead and not getting pulled out of place. So for this one, this is one that I would say is a moderately advanced variation here. And you can see actually on me, look at how my hip is kicking out away from my body. What I would actually like to see here is a more piston type action where this toe is staying neutral and this knee is tracking directly under the hip. So honestly, this is a good bad demo here, but we want to see that maintaining of vertical stiffness in the torso and being able to replace our feet without coming out of position. And one more band variation here for you, and this is again another one where I'm using a combo load here, so a kettlebell on the outside arm and then a band on the inside arm. And here the band offset is really challenging first arm AB adduction, so maintaining a long fixed arm position here is going to get our pec minor. We're going to get some serratus again, and here with the torso position, we are resisting being pulled this way towards the band axis. So now we're getting some good anti-rotation here. This is also one that I think is really good for adduction, AB adduction at the hips as well. But here the goal again is to try to maintain a vertical position, and we should perform this no differently than we would a standard load. So maintaining a good vertical torso, not letting our knee get collapsed or cave in. Angles on this one actually look decent, so not too bad of a demo for you, but this is another one that is, I would say, pretty intuitive for most athletes, not too advanced on this one. Dumbbell, kettlebell, uneven applications. This is another one that's relatively simple. I would say this is a novice to intermediate application. This is a way that you can preface or kind of work your way into actual barbell offset loading and getting a feel for it with a little bit less demand and a little bit less risk involved. So kettlebell, dumbbell, uneven variations. I often go to an incline bench press, bent row. We can go single leg row, RDL, overhead press, split squats. I mean, really anything that you would generally do with a dumbbell or kettlebell can be applied here as well in an uneven fashion. So now we'll look at a dumbbell uneven application here. So we see in this hand, I don't even know what these are, but we'll say this is about 15 pounds here, and this dumbbell is going to be about 30. So for single leg variations with the uneven application, and the same thing for the barbell offset loading, I will set this up to where the heavy side will be inside the leg, and I'll set this up to where the heavy side will be outside of the leg. So for an RDL specifically, with the heavier side being on the inside of the foot, what we are challenging specifically is getting to the lateral border of the foot or maintaining more of a supinated presence on the foot, because the heavier dumbbell is going to want to pull the foot in this way into pronation. So if you're somebody who gets that involved where you look at the pronation supination balance of the foot, and you have somebody who is a supinated deficient athlete, you would want to load on the inside. For anybody who's in kind of just in general terms, I would just say go both. But either way here, with our uneven application, we're treating this like it's bilaterally loaded, so this should be performed no differently than any single leg RDL. We'll also get a little bit more medial lateral control demand at the knee here, because the heavier weight is going to want to pull the pelvis in towards the midline. We're going to get a little bit more fight there on the AB adduction as well. Another simple uneven application here, so this one just being a bent row. This one we're going to get, I believe, a little bit more out of the scapular patterning, because we're going to have some different demands for co-contraction between the scapula. But you notice the dumbbells are moving at the same time, at the same position, because again, you want to treat this as if both sides are moving the same weight. And for here, this is one that I would say is very, very basic. This is one that we can apply for just about anybody. Then we get to kind of the main entrees, the barbell offset variation. So you can do this as either a static or a dynamic variation. So in the third frame here, you see, we have just plate loading on one side, nothing on the other. And then in this fourth picture here, we have even distribution of plate loading left to right, but then we have an orange band set up on just the right side here. So the theory here is, again, we're really emphasizing anti-rotation and anti-bending. So let's use the split squat real quick. Having this band pulling on the right side, I'm now not only just fighting the load of the barbell in the split squat, but I'm also resisting lateral trunk flexion to my right in this case. And then this is also going to give a little bit of frontal plane pull to the hips. So a little bit more highlighting here on the adductor on that front leg. And then on the back leg here, we're going to get a little bit more out of the glute med, glute min. For our static applications, here's a real good one, a reverse lunge to a step up pattern. So Here I'm going to have my left leg be the working leg really, and the offset is going to be to the left side, but same thing applies here. We can do this any which way, whole combination of ways, but for this one, not only are we getting the challenge of the offset patterning, but also getting the difference or the change in working muscles from a step up to a reverse lunge or a deficit lunge pattern. So there's a lot going on with this one. This is probably something I would say is more intermediate advanced, but this is a really good variation here, and you're going to get a lot of ABA deduction at the hip. You're going to get a lot of trunk demand on this, and then also, again, down at the foot, controlling pronation, supination as we go through this pattern. Another static application here. So now we're looking at a single leg bent row. So again, this is one where we don't want to just think about the scapula or the back or even just the torso with this one, but this is really heavy demand on foot, lower leg, knee control, and then again, that stance leg hip, being able to keep a squared pelvis where the hips are squared down to the ground. But treating this like it's bilateral. And for here, we want to make sure that we are staying active on this back foot, because this opposite glute here is going to be key for stability. And let's see. Yeah, my hips are a little bit canted here, not too bad. But for this, I want to think about rolling that right hip, the front of the right hip down to the ground, so that I'm getting a good constant tension at the hips and not getting pulled out of position here. So this is one where I would definitely go bilateral first with an offset load, and then work to a single leg pattern on this. And one more static variation for you here. So another way that I'll use this quite frequently is just with carries. So using an overhead carry setup here with an offset to the right. This is one where we can probably load a little heavier on. And another factor here with this is where the hands are going to be placed. So if I have my hands evenly placed on the barbell and in almost like a snatch grip hold here, this is going to be real low demand. If I start bringing my hands in closer to the midline of the barbell, or if I start to offset my hands, this becomes significantly more difficult. But using this for a simple carry, this is a really easy variation to throw in. And again, it's another one where I look at the efficiency of, getting kind of return on investment or return on time. This is something for advanced athletes where instead of just having them do an overhead carry, we can just offset it and get, I would say significantly more out of the movement. For me here, we would want to see ribs pulled down a little bit more neutral in the low back. But other than that, you would just want to kind of track the gait pattern, make sure that the legs are moving as they normally would. So now for some of the more advanced applications here. So we'll take a look at the band offset variation here. So you see we have the orange band attached off. Like I mentioned on the uneven stuff, this is one where I'll have the band offset to the right with the left leg forward, and I'll have it where the band is to the right with the left leg forward, and then I'll also do it in the opposite fashion where left leg will be forward with a left offset. I just think that we're kind of shotgunning the ABA deduction at the hips with all of these, and unless you have something that's specific, it's good to just kind of hit all of them. So you'll notice here that there's a little bit more fight on these, and even just using an orange band, this is actually a pretty demanding application here. So maintaining good control with the knees, maintaining good control with the feet, not getting pulled out of position, and maintaining that good stiff torso as if this are bilaterally loaded. And with the band applications, we want to make sure we're accelerating through the top end and finishing fast here. So our second band offset application here, this is an overhead press. And again, you'll see even just with an orange band, this is going to be a good fight for me. So with the overhead press pattern, don't just think about the upper body or the torso position here, but also pay close attention down to the feet and the knees and make sure that we are not getting pulled into a weird position when we go into our counter movement on this. But on the band offset, we want to finish fast and tall. And again, trying to maintain our vertical position without getting pulled out. So going another layer deep here on the theories and perceived benefits, when we look at the neuromuscular end, a couple of things that have been theorized here, and this is something that, again, is unsubstantiated, but I believe this is also very intuitive. So we're looking at increased neural drive, and very simply, if there are different or new vectors that are present during a movement, then more muscles are going to have to be involved. And when more muscles are involved, we have a total increase or a global increase of neural drive, which also comes with corresponding intramuscular tension and also motor unit synchronization. I mentioned the contralateral reciprocation. So really, we're thinking like a constant fighting of pushing and pulling forces at the trunk, where we are trying to maintain a bilateral position and really override getting pulled out of position. So there is a lot of belief also with offset that this is something that can kind of help clean up poor technique, or athletes who don't really transfer force or don't have good kinetic integration, because you have to stay so conscious throughout the entire movement. It's impressionable really for athletes, especially on the younger side, to feel what it's like to have to resist that torque. I mentioned it a bit, but the mechanoreceptors, the joint receptors, are also going to be on high alert kind of throughout the entirety of the movement here, because of the lack of familiarity and because, again, of the shearing and the torque that's present with this. Trunk stability we've hammered pretty good, but I think one thing that we can add on here is perhaps this is something that emphasizes the fascial slings and the fascia tensioning. I've spoken at length about the fascia slings, but we're looking at, contralateral shoulder to hip on both the front and the back side. And I know anecdotally, when I've done a lot of offset work, I can really feel that fascial connection kind of getting exhausted a little bit more than it would on a standard loading. The work capacity piece, this is one where, this is highly efficient. And I think this is something that if you lack time or if you lack equipment variability, then offset loading is something that you can utilize to just increase your work rate and increase the level of demand or effort. You will definitely notice that this is also very mentally fatiguing, especially the first couple of times that you go through it. Vectors are obviously a big piece here. So when we're thinking about the fascial vectors, we're thinking about just the different densifications and kind of the trains or the lines of pull here, in how we get into our spiral chains and our spiral mechanics at the limbs and the extremities. But on a muscular side, I really think this speaks to the pennation angles. And, if we look at something here, like the external and internal obliques here, if we look at the angle at which these run, and the lat is actually similar on the backside here, we can even kind of include, the pec minor really. I think that when you have unbalanced load distribution left to right, it kind of forces these muscles that run at these pennation angles to kick on or get a little bit more engagement, because of the change in lever arm, basically. And that, kind of goes back to tying in with the joint receptors. But that's really all we're effectively doing here, is we're just kind of manipulating the basic lever systems because of the change in vector or the change in weight distribution. So with this, this is something where if I have an athlete who has, really, really big anterior delts, or they have, very prominent abdominal muscles, even athletes who have, really big trap muscles, those sometimes are kind of indicators for me that, items like the obliques or the serratus group, or on the backside, some of the inner deep back muscles, the lower trap, and some of the lower lat muscles, those can often be undertrained. And I think that if there's a large margin of difference between prime movers and synergists or assistant movers, we're kind of setting ourselves up for potential injury risk. So when we're talking about vectors and kind of the tension or torque distribution throughout movement, I'm almost, I guess, biased at this point, but I'm always going to go right to the hips and then look outward from there. So this is a cool little progression here, using kind of a lunge chop combo pattern here, and then obviously with an offset load. Now, I've said a couple of times throughout this that I'll do, offset to the right with left leg forward, and then I'll do left leg forward with a left offset. For this particular setup, I'm going to want to have the offset load be opposite of the forward leg, and that is because of our spiraling mechanics at the hip here. So I'm thinking this fascia chain right here, right shoulder to left hip. So for this particular setup, the weight will always be opposite the leg that's working forward. So for this here, I'm just going to use the offset load. And again, you see it's only a 10-pound plate. This one does not take much, but I'm going to use this as momentum, pulling into a chop pattern or a rotational pattern here, and basically emphasizing deceleration at the bottom there, towards flexion. So for this, we want to think about the timing where we want to have the decel and the trunk angle be succinct and together. The second step from there, and you can see I added my clip, is just adding a little bit of a knee lift here. So now we're going into that deceleration pattern as we were before, but then coming up and driving into a almost a sprint stance there, getting more of the stance leg abductors. Now I'm just stepping into it, adding a little bit more velocity to it. So this is just more of an advanced variation of the first one, but adding speed and momentum to it. And then finally here, now we're doing some overhead marching. And for this, again, the goal being to just stay vertical. The barbell should stay perfectly vertical, or I'm sorry, centered overhead, and then balanced left to right. And we're just thinking about trying to strike down and attack the ground and then maintain good torso stiffness here. So if we kind of break this down to a demands or a needs list, and we can even add on to this and saying kind of entry level up here and then more advanced or intermediate in this end down at the bottom. But who is a good candidate for offset training? Well, I'll start with saying that globally, or generally speaking, just about anybody. I think this is something that's good to sample in your programming at minimum, and something that you can just kind of keep in the warm-up or keep in the accessory block infrequently throughout the training here. But on a more needs demand, athletes who have poor trunk stability, poor trunk control, I can also lump in lumbopelvic disassociation, trouble with that, not really being able to effectively brace or engage in multiple positions. Offset loading is something that could potentially be really good for cleaning that up. And, if we stick with the rudiment of just poor trunk stability, I would say that these entry-level variations here, band offset and dumbbell kettlebell uneven, are probably going to be your best bet. If we have an athlete with rotational deficiency or shear intolerance, then, again, these first two preliminary ones, band and band offset and kettlebell or dumbbell uneven loading and static offset loading, are kind of going to be your bread and butter. An example here that I think about is, a college pitcher coming out of a season and having an increased margin of difference between throwing and non-throwing side. Offset loading is something that could be used to help kind of recalibrate the athlete and getting them back to square one. On the more advanced side, if we have, athletes with poor kinetic transfer or just general motor control, proprioception, these, the more advanced options here, barbell offset static and dynamic, are going to be your go-tos. And then for motor control, proprioception, literally every single one of these is going to hit the nail. So if we look to the programming piece now, again, I would say this is something that is rather frequent for me with my athletes as accessory options, semi-frequent for warm-up, and then, with secondary block or, the barbell-based movements, that's going to be a more case-by-case thing. This is definitely not something that I throw every athlete that I work with into. It is by no means a demand or something that needs to be done, but when and where it's needed or when it's capable, again, I get a lot of good usage out of this. So when we look at the warm-up and the movement prep section, band offset variations, calisthenic, body weight oriented, unbalanced or uneven carries are something that I do perform often. So having like a 75-pound dumbbell in one hand and a 45-pound in the other, those are good to just kind of kickstart and get things rolling. The primary block, I can't say that I use this at all in a primary block, or very, very rarely. I think that, the primary block is best suited for just general force application and or strength power development. But the secondary block is probably where I get the most usage out of this, at least with the barbell variations. So I'll use this in a litany of different ways, which we'll actually get into a little bit more on the next slide. But that's probably number one, is the secondary block. And then, as I mentioned, accessories and auxiliaries, it's something that'll come and go. It'll be a situational thing depending on what the athlete needs or what they're capable of, but I'll find different ways to work this in the accessory block. So if we look now at an actual program sample here, so this is taken from actually an offset specific program that I put together a little while back, and I believe this is an example from like a hypertrophy phase. But what you notice off the top here is about half of the training day on either day here is going to come from an offset application. And in addition to that, the secondary block, so our 2A movement, is always going to be the exact same as our primary block. So let's go through our, a sample day here in full. So let's say we come in and it's a lower body day. We're going to, we have back squats at 65% for 10. I'll come in and hit back squat, depth jump, boom, 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 16 minutes. And then when I come down to my block 2 here, what I'm going to do is redact about 20% from the intensity, cut the reps down in half to 5. You see our offset load here is plus 10 to 15 pounds, and we're going to be doing this with a 3-second eccentric tempo. So if we were at, 200 pounds on our back squat for 10, we'll come down to about 135 arbitrarily, we'll say, and we're going to cut the reps down in half, but we're going to have 135 plus 10 to 15 pounds on one side and throw that tempo in there. That gets really, really exhausting. And it doesn't take too many sets to get there, but I'll combine this or pair this with a dumbbell uneven RDL, and we'll see here, again, 5 reps at tempo with a plus 10 to 15. So this is holding a 45 in one hand and a 30 in the other. So the way I'll do this is let's say the offset is to the right. I'll have the athlete go 5 reps with the offset to the right, come out, dumbbell uneven RDL, heavier dumbbell in the right hand, come back, left side offset, 5 reps, back to dumbbell, left side heavy, 5 reps, and then work back and forth between that. And then, the accessory down here at the bottom, dumbbell uneven step up. So the accessory block down here, I have 2 different movements, but 1 to 2 is normally sufficient for the accessory block. And as I note over here, I'm always going to prioritize this first, this second, and then this third. I think that if we're trying to do offset work, we need to keep that the priority. If you got to cut the weight way down, no harm, no foul. So looking at this across more of a macro cycle here, the corresponding percentages, if I'm in a strength endurance phase, so we're working in that 55 to 65% range, I'm going to subtract about 10 to 15%. So that's going to put us at about 45 to 50% for our offset work. And I'm going to use about 5 to 10 pounds, again, the exercise specifics and, the tenure, the familiarity with this application that the athlete has are going to be factors here. But generally speaking, 10 to 15%, 5 to 10 pound margin, and usually I'll throw a tempo in there for strength endurance. Coming into hypertrophy, so we're up in that 65 to 85% range. We notice now that in the secondary block, we are now redacting 15 to 25%, so we're looking at 50 to 60% of our 1RM plus 10 to 15 pound load. So we've increased the amount of total load, and we are increasing the amount of offset load. So I mentioned, first we want to prioritize the offset load, but what I also want to prioritize is increasing my total load first and then coming down and increasing my offset margin. So if we think here, running through a 3-week cycle of strength endurance, I'll increase my total load across those 3 weeks, keeping a 5 to 10 pound margin. And then when I get to my next phase for hypertrophy, now I'm going to look to increase the offset load with an increased total load. Rounding this out here, for a strength phase, so we're up in our highest percentages. Now we're going to cut down 25 to 35%, which is going to bring us to about 60% here for the total load. And we are now working with a 15 to 25 pound offset, which is about the highest that I'll really ever go with a barbell setup. And we see we're now using an isometric tempo. And lastly, power velocity phase. So now we're back down to some really light percentages. We're going to come back to redacting down 10 to 15%. And now our offset is going to be band tension rather than static loading. And I will say with band offset loading, you absolutely do not need a lot. An orange band will honestly be sufficient for most for quite some time. But I don't really see a case where you would want to go above a red or maybe a black if you're very, very strong. And this will be done under velocity or speed conditions. One kind of sidebar or addendum here to wrap this up is the effects that offset loading has on the foot. And what I've noticed with this, especially with single leg exercises, and we'll take a look at a video here in a sec, but this really ups the demand for medial-lateral control and kind of force distribution. So we know that the ankle-foot complex is, a highly sophisticated mechanism, but it's constantly working in all three planes of motion at all times, and especially under load. So when we add offset loading to this, it really drives up the demand on the foot and also the effects on the lower leg. So if you think about the kind of the spiral chain that envelops the lower leg, the presence of offset loading, I've noticed, really drives the demand on the lower leg muscles to help keep the foot in a neutral or stable position. And with, all things else being equal, I think this is something that doesn't just elucidate or emphasize the core, but this is also something that really just emphasizes the lower leg without even really having to do anything deliberate. So if you have an athlete who's coming off of ankle sprains, or if you have, an athlete who's been suffering from plantar fasciitis, coming off of a turf toe, this is a really novel way that you can kind of isolate or emphasize those injuries without having to, carve out something entirely different for them. It's just, a very simple step, and they don't have to be sequestered away from the group, so to speak. So offset loading is something that could definitely be very beneficial for the foot and lower leg in and of itself. So I mentioned that, this is something that's really beneficial for the foot and the lower leg chain. So for the sake of this, we're just going to pretend I don't have shoes on here. But this is a single leg liftoff with an offset to the medial side of the foot. So again, we're kind of challenging the supination pattern here and a little bit of inversion specifically. So this is going to be one where we will want to see very specific and precise movement on this. So I'm going to want to pull off here just a couple of inches and then come to an abrupt halt and then not let the weight pull me out of position. So I'm going to shoot for just about mid-shin, just below the knee, start with the barbell level, pull off. All my tension is in my stance leg hamstring, and then we're making sure we're not getting any counter rotation at the torque here or at the trunk here as well. But as you can see from the veins in the neck here, this one is a little bit more demanding than it may appear. And lastly here, just to finish this out, I feel like I absolutely have to cover some safety and precautionary things here with offset loading. As I mentioned at the start of this is certainly not something that I would do with young athletes. This is not something that I would do with people who are presently injured. And this is not something that I would do, honestly, with people who tend to be absent-minded in the gym. This is something where if you just kind of have a mental lapse and you forget which side is offsetted, or if you aren't paying attention changing the weights, that this could cause problems. So be selective with who you use this with and know who your good candidates are. But at the very least, make sure that you have a very solid foundational strength base before jumping into this. So let me run through this real quick for you. But loading the bar, make sure you know which side is overloaded, and always be present in mind of which side you are starting and ending your sets with, so you don't over or underdo one side. Also be aware that there's going to be a potentiation effect. So if I'm doing a back squat and I have the offset to the right and then I go to do the left side, it's going to almost feel like it's 1.5 times on the left side. And that is a neurological effect, but just something to be mindful of. Always use clips when you're doing offset work. There's no reason to take an unnecessary risk, and this does, challenge the balancing of the barbell. So make sure you're clipping up, and be particularly careful when you're loading and unloading, especially when you're using band offset. To progressively load this, I would say start always with band offset variations, definitely the lowest risk, and also just the easiest way to get people to get a feel for it. But once you can get comfortable there, I would then progress into dumbbell kettlebell uneven and start with a 10-pound difference, pretty much irrespective of what exercise you're doing. Maybe 15 or 20 for some lower body exercises, but always start light, get a feel for it, and then grow from there. I mentioned it, but progress total load first and then the offset load second. And for, again, all intents and purposes, I would never go above about 40 or 45 pound difference on dumbbell or kettlebell uneven. Static loading, same parameters, but for here, I would say the upper limit is about 25 pounds. I haven't really found a reason to go above 25 pounds, to be honest, on anything. And then for dynamics, it is a unique setup. So for this, just be very careful and make sure that you're using that with the right person. That is certainly an advanced application. Lastly, here's some general notes. The movement should always be treated as if they're evenly loaded. So just because we have an offset setup doesn't mean we're doing anything different. This should be cued the same. It should be executed the same. And we should treat this just like a bilateral movement would be as well. There's going to be some increased fatigue with this, I would say, for a lot of people, especially in the low back. So for this, make sure you're differentiating between discomfort and pain. And if anything gets beyond something that's manageable, please shut it down. This is not something that requires a ton of volume, and be wise with that. All in all, this is something that is definitely beneficial and I think has a lot more value than we may be presently aware of. But at the same time, this isn't anything that's going to be, a magic cure or pill or anything like that. And it's not something that's going to supplant conventional loading. I think this is an in addition to type of application, not something that's going to be in lieu of. Hopefully that was helpful. And if anybody has any questions on any of this stuff, whether it be application or, safety based, or whether or not someone's a good candidate, please feel free to reach out to me directly. I'm always open to talk shop on this or anything otherwise. And if you are somebody who is, on the coaching side and you want to have any conversations that are a little bit more in depth on this, please feel free to hit me up. I'd be happy to go through anything that I've used on this front.